Life lesson 6, take pride in who you are and what you do. The pride that I take in being able to help a patient at the most vulnerable, the most delicate, the most trying times of their lives. The ability to have the nursing knowledge and the experience to be able to help with a symptom that nobody else can figure out how to fix. The ability to comfort that family, the ability to help that patient's family deal with the inevitable, to give someone a death with dignity. There's nothing out there like it, and I love it and always will.
I'm very proud to be not only a home health nurse, but also an oncology nurse. I became an oncology nurse because of my mother, who had 1,000 questions when she had her chemotherapy, and that's how I got involved.
I had a personal experience on oncology nurses when my husband had rectal cancer, and they're just awesome. They're just there for us, and I appreciate every minute of the time they spent with me and my husband. Oncology nurses are special, and nurses are special.
Life lesson 7, find a good work environment. I moved to Florida and started at a very large cancer center here in Florida, and I finally found a home where I fit, I was understood, it was like-minded people, and now I wind up here with the Nature Coast nurses, where we're trying to bring others into that same fold. I used to get in trouble because I didn't do enough baths and beds. I spent too much time talking to my patients, and I was constantly in trouble because I spent a lot of time addressing the spiritual and the psychosocial needs of my patients.
Oncology nursing started for me back in the mid-'80s. I'd been a nurse just a few years and floated through the hospital. And whenever I went to the oncology floor, for some reason I felt like I was doing more for the people and I was more appreciated. So I found myself requesting that floor and wanting to be there, and eventually applied for a job and am still in the field of oncology nursing and stayed there for over 25 years.
I love where I work. I work on a 23-bed medical oncology unit with great other nurses, great patients, great doctors. I couldn't ask for anything better to work at and learn as being a nurse.
I became an oncology nurse when I moved to Florida, which was 10 years ago. And I immediately went to Moffitt Cancer Center because they just told me it was a wonderful place to work. And I worked there for 8 years. I worked in a general oncology unit, and my last 4 years were in a bone marrow transplant unit.
Life lesson 8, if passion sparks, let it flame.
Well, once I got full-time into just oncology, the bug was bitten then, and ever since then, I've considered myself an oncology nurse. I've maintained my certification. I teach the chemo course. I proselytize and encourage people to go into oncology. And even though I'm not working only oncology now, I reach out. I do a lot of education for oncology nurses.
Life lesson 9, do it even if it is difficult.
And I still think that we have the best patients of any unit in the hospital, and no patient wants to get better more than the oncology nurse's patient, and that makes it much easier to be a nurse, even though some people think it's a little more difficult to be an oncology nurse, but it really does make it easier. And that's why I became an oncology nurse.
Hi, my name is Lynn. I am an oncology nurse, but I'm also a home health nurse. When you send me a nice patient in home health, and I'm being an oncology nurse, I'm able to help them get over the fears and the problems of chemotherapy. A lot of patients are anxious because of the chemotherapy and have many questions that they don't ask at the facilities that they come from. So they have their home health nurse, which I am.
It is a difficult job at times, but ultimately it's a very rewarding job. People always ask me if it's depressing, and it's not depressing. It can be sad, but it's not depressing. You're there to do the best you can, and whatever help you can to these patients.
Several years ago, they had a button that they distributed at ONS Congress that said, no, being an oncology nurse is not depressing. I think that's one of the most rewarding things about being an oncology nurse is that sometimes it is difficult. It's you give a lot of yourself, and it is difficult. It takes a lot of energy, but it is one of the most rewarding things that you can ever do in life. And life lesson 10: persevere in all things.
No, I waited 2 years after I got out of high school. Then I was old enough to go into training, and we spent 3 long years becoming a nurse, and I worked for many, many years.
And how old are you now? How old are
Do
you?
you want to know?
Well, yeah.
96.
96. And you've been, what, how old were you when you became a nurse?
23.
Okay.
Anything else I can't remember. No. Can I go now?
That's good.
We are the Nature Coast Nurses Florida chapter of the Oncology Nursing Society. We thank you for watching 10 Life Lessons Learned by Being an Oncology Nurse. We consider ourselves to be unique in our passionate effort to bring into the Oncology Nursing Society nurses who do not traditionally see themselves in that role so that they can learn these and other important life lessons that come from caring for patients with cancer. Our chapter meets on the 2nd and 4th Monday of the month. You can find us on Facebook as well as the virtual community.